Hey besties, welcome to the very first episode of the Nurse Aspect where we assess and evaluate. My name is Nurse Becca, and as your official work bestie in your ear, I'm here to help you get through all things nursing related, whether you're in school or you've been a veteran for like 20 years. Welcome to the show. I wanted to create this space for a couple of different reasons. In my experience, I met a lot of different nurses. One, I met nurses that would work in a specialty, they would leave the unit and they would go somewhere else and they would hate it. They shadowed, they did all these things, and shadowing didn't really help them at all. It would just kind of give them maybe a baby glimpse of what was to come, and they maybe loved that experience. But when they actually get to the floor, they're like, what is this? This is not gonna work, and they end up coming back. Or sometimes like you don't even have like maybe a way to get into that specialty and you just kind of want to get more information. On the show we'll talk to different providers, different nurses, and see what they're doing, and maybe you'll be inspired to either take that leap, or maybe you're like, nah, this let me pull back a little bit. This is not for me. The other reason why I want to create this show is because we do need support. A lot of times, like, we go through things as nurses. We take on the stresses of our patients. We take on, whatever the doctors are hurling at us, and we often, end up taking care of other people, but no one really takes care of us. When we try to like maybe vent to our significant other, or you talk to your friends, they don't really understand what we're talking about. Nurses understand nurses. So this space is for us. We'll talk, in our own little nursing lingo, and you'll understand exactly what we're talking about. Um, the other thing I end up finding too is a lot of times, like, no matter how many times you have friends on the floor, or your coworkers, or whatever you have it, a lot of times you kind of feel alone. Like, especially, let's say you're a brand new nurse, you're coming into work, you're clocking in, you don't even know where to clock in. You start working, and no matter how many times people come up to you and like, oh, do you need help or something like that, you end up feeling alone. Don't worry, I got you. I'm in your ear, and I'm here to help you get through that. This is my story. I got into nursing. Let me back it up. When I was in high school, I really didn't know what I wanted to do. I took some test that pretty much gives you an idea of like what field you want to go into, something like that. And my score was pretty rare because no one ever gets 50-50. Mine was 50-50. So I got 50% interior designing, 50% medical field. So I was just like, all right, being a descendant of Caribbean parents, I knew I could not go and tell my parents that I wanted to go into interior designing at all. It was not going to happen. They would look at me like, you're crazy. You're going into medical field. In fact, you're going to be a doctor. I already knew what the conversation was going to be like. So I was like, all right, medical field it is, but what in the medical field? I don't know. I didn't want to be a doctor, nothing like that. And I went on this like retreat, and someone came up to me and was like, God told me to tell you that you're going to be a nurse. And I was like, all right, I guess I'll be a nurse then. I guess that's what's going to be. So I applied to different schools, like during high school and stuff like that. And I got into a pretty prestigious nursing school, but I never knew what the tuition was like. Once I got the bill, I was like, oh, nah, that's not going to happen. I'm not paying this amount of money. So I did not go to that school and ended up going to a community college. When I got to the community college, I really wasn't ready for it. I feel like coming from high school, I overloaded myself. And so I dropped out and took some time off. And when I finally decided it was time to get my life together, I was like, okay, I'm going to start out by being an LPN. So I did like a year program. I graduated, took my boards, and I got a job like a few months later at like a nursing home, long-term care facility. I was there working overnights for like 6 years. And while I was doing that, I decided to go back to school to become an RN. I didn't do much research in becoming an RN because I felt like I had to go to a big name school to get a good job. And that's definitely not the case, because at the current moment, my debt is like six figures, and it should not cost you six figures to go to school at all. I highly recommend people doing research. There's a million ways and a million things that you can do in terms of getting your RN degree. Do your research, okay? Don't be like me. But after I graduated right during COVID, like at the top of COVID COVID just hit while I was doing my last semester. So when I took my boards and got a job, it was relatively quickly. For me, I'm a hustler, so I felt like it took too long, but in nursing world, it didn't take me that long for me to get a job. I started working at an acute care facility and I was in med-surg tele. That was what I could get. That's where I got my foot in and I was happy for it. For me personally, I was not trying to be a peds nurse or psych. Those were the two things I was avoiding like the bubonic plague. But I got into med-surg tele and I was nervous, but I did it. I love being a cardiac nurse. It took me a while to kind of get my bearings, but I love being a cardiac nurse. I loved learning about cardiac things. I loved the patients ish sometimes, because you know how patients can be sometimes, y'all. But I love, like, you know, my coworkers. I love precepting and orienting. This is where I found that I actually love educating, but I love being a nurse. Afterwards, I stayed there for about 2 years and then I became a labor and delivery nurse. Now, labor and delivery, I feel like my nursing girlies out there and you know guys that love like seeing babies, let me tell you, labor and delivery is not what you think it is. Yes, it's the miracle of life and that's beautiful. It was when I shadowed, that was the first thing I saw and I was so grateful to see that. And I'm like, oh my gosh, I want to do this. Actually working in labor and delivery is hard work. Taking care of a mom who's laboring, um, emergencies can happen at any second. And depending on where you work, sometimes you have to be mom and baby nurse. It's a lot of work. Like, don't be fooled by that. Shadowing, like I said, you don't really get a gist of it. You get like literally like 2% of what you're actually supposed to do. There's a lot of things that go into actually being a labor and delivery nurse. But would I change my mind? Do I see myself going anywhere else? Not really. I mean, aside from those podcasts that I'm doing, but you know, like I said, nurses, especially me, I'm a hustler. It's great, but take it for what it is. I'll tell you all the skinny on labor and delivery sometime in the future. All right, guys, so I wanted to introduce you guys to this part of the show I like to call the nurse's note. As nurses, we all know we have to document. We have to pretty much just document in terms of what happened with our patients, what did we do, what event occurred, because you never know when it's going to come back to bite you in the butt like 20 years later. I wanted to create this specific part of the show where we can memorialize our own events, things that we want to share, stories that we want to tell others, that maybe either inspire people or maybe just get something out of it. Maybe you'll laugh, maybe you can relate, maybe not. Either way, I hope you enjoy. So this is my nurse's note. When I first started as a RN, I did not know how to give report or take report for that matter. I remember getting report from this particular nurse. He went through, you know, the patients and stuff like that. I was fumbling around with my papers. I was writing down things that I felt like I needed to write down, or maybe I didn't even write down the things I was supposed to write. After he left, I went to go and check my patients. I had maybe 5 or 6 patients that day, which was average, I guess, for a med-surg tele unit. I go into the first patient's room. I walk in and I'm like, uh, this patient literally just had dentures like hanging out their mouth. And I'm just looking at this patient like, what's going on here? Like, this looks crazy. But like, the patient just didn't look well. If I'm telling you the dentures is hanging out the mouth, it's not. We're not starting off a good note. So I'm like, all right, I can't find a PCA. Even though I need to check my other patients, I kind of felt like this was priority. Let me do a set of vitals. I checked and the blood pressure was a little soft, but I'm like, what do I have to compare it to? I have no baseline. I didn't really take a good report. So I'm still standing around the room. I'm like trying to figure out, okay, what do I do? Is this an emergency, non-emergency? Do I call a rapid, not call a rapid? I don't know. I'm looking at this patient and clinically she's looking like she's getting a little worse in my eyes, but I'm like, I need help. I pop my head out the room and I end up seeing a senior nurse. And I'm like, all right, can you come to the room, just like take a look at the patient? I'm not sure if I need to call a rapid or not. She comes in, she looks at the patient like, I feel like with one eye, she was like, we're calling a rapid. So I'm like, all right, cool. She calls a rapid and I'm like, I know I have to stay in the room. So I'm sitting there with my papers. I'm primary nurse. I'm like, all right, this is the first time this is happening to me. This never happened to me during orientation at all. There was no emergency during my orientation. This is like my first rapid on my own. The team comes in and the doctors are like, all right, who's the primary nurse? I'm standing there. I'm like, me. Okay. they'll ask me like, okay, why is the patient here? And I'm reading my paper and I'm like saying stuff from the emergency room, and I'm like, they're looking at me like, okay, you saying stuff from the emergency room, like, why is the patient actually on the floor? I had no idea. And so I'm sitting there like struggling or whatever, can't find anything. I'm like, I don't know. They're looking at me like, all right, you clearly don't know what's going on. So they just kind of end up taking over, and I just felt so embarrassed. I was just like, this is crazy. This is my first rap, and I had no idea what I was doing. My point is, guys, for sure, you want to make sure that you know your patient. I would say that lesson taught me that I need to, one, come in early, even if I just pop my head in to look at my patient first, and see what's going on, make sure I'm like looking at labs or whatever. I want to do those things first. That way, when I'm getting a report, I can ask the nurse like, "Hey, is this how the patient was?" To kind of get my bearings. If I'm gonna have this patient for about 3 days or whatever, and if anything happens, I should know. I also needed to learn how to actually effectively take a report. A few weeks later, I ended up running into a different nurse who saw how much I was struggling, and he kind of gave me like a little template, which is something I had used for a very long time until I started working in labor and delivery. But I used that for a long time, and it served me well. So I would say for sure, get to work early as a brand new nurse. Okay, see your patients. Don't be afraid to walk in. You don't have to really even say much to the patient. Just kind of get a layout of the field, and then go through your charting and make sure you ask questions. No question is too small. Don't feel like you're gonna be dumb, because if there was any type of code that was to happen right then and there, what would you say? Don't be afraid to ask questions. I hope you guys enjoyed my little story. More to come. If you guys have any questions, comments, concerns, you want to share a story, or maybe you want to be on the show, contact me at thenurseaspect@gmail.com. Like, subscribe. I'm on YouTube, all the things. All right. And I'll see you guys next week.